Welcome back. We're still talking with Leanne Holmes this morning about long-term care and senior living options and how to make the right choice for you or a loved one. Welcome back, Leanne.
Thank you.
So moving on, I'd really like to talk to you about the other facility option, which is the adult daycare. I had not heard of this. So can you tell us a little bit about what an adult daycare center is, especially compared to a nursing home or assisted living?
Sure. So as the name suggests, adult daycare facilities offer adult daycare.
Okay.
Similar to taking a child to a daycare during the day, you would take your loved one so you can go to work, so you could go shopping, so you can have some respite time. It's a perfect option for people that want to keep their loved ones at home, but they don't want to get burned out, and they have other things to do in their lives. So in Montana, we have one adult daycare center, and the rest of the adult daycares, there's 57 others, and they are incorporated into another type of facility, the facilities that we've already talked about, the assisted livings and the long-term cares and the critical access hospitals.
Okay.
So the services that they provide are activities, assistance with ADLs, medication assistance, and meals and snacks. So it's kind of just a very light level of care, just intended to give families a break.
Sounds good. So does a person have to meet certain requirements to get care at any of these long-term care facilities, or is it up to the person and their loved ones to decide what care level of care that a person might need?
No. So loved ones and the families need to, they have the responsibility for deciding which facility is best, but each facility type has assessments that they're required to complete to identify whether they can meet the needs of the residents in that facility type.
Okay, good. So one of the big concerns for people is, how do we pay for long-term care options? It's a very valid concern, of course. Can we go back to nursing homes for a minute, maybe, and start there? And someone knows they need 24-hour care that's to be provided by a nursing home. What are some ways they might be able to pay for those nursing home services?
Right, so nursing care, because it's the most extensive and the highest level of care, is obviously the most costly. And it really is a challenge for a lot of people. The national average for nursing home care is about $200 a day. Medicaid, there is some assistance available through state Medicaid programs. There's criteria with that, of course, non-financial criteria and financial criteria. And it's best to just call the your local area on agency or the Department of Public Health and Human Services to see if you qualify for Medicaid benefits. Medicare benefits are limited in nursing homes, but they could be provided in, say, a rehab situation. Medicare may be used for that. So it's kind of short-term skilled nursing care. There's some options for veterans, and I would just encourage people to go and contact the VA. Long-term care insurance, and then some people actually pay out-of-pocket costs.
So if a person has Medicaid, can they qualify for Medicare as well?
They can. There is some dual eligibility, and again, the best contact would be to contact the Area Agency on Aging and get some help with kind of navigating the system.
Great. So aside from the cost and payment options, what else should people be looking for in a nursing home?
So I would say the best thing to do would be to go on. There's some national clearinghouses that that have information about care. They rate the care of nursing homes. These are facilities that are certified by Medicare and Medicaid. And so a great place to start would be Nursing Home Compare. You can also talk to your doctor. Usually your community has some ideas of where are the best places, and needs differ, and facilities provide different levels of care to different populations. I would also visit some nursing homes, look at the residents that are there, look at the facility. Is it clean? Take a walk through, have a tour, have a meal there, talk to staff, talk to residents, talk to families. So you can also see if a nursing home is accredited by the Joint Commission.
Okay.
And so that's another option.
Good information, thank you. So let's move on to assisted living. And let's talk about how people can pay for that option. We have about
Okay.
a minute or so left, and so if we can
Okay. Sure.
give some highlights on that, that would be great.
Sure. So most assisted living, and I would say I would just lump in there adult daycare, is paid for out of pocket. There
Okay.
is some Medicaid waiver that pays for some services. There are some slots in assisted living facilities. Long-term care insurance covers some of the expenses in assisted living, and Medicare does not. Again, there's more assistance available through the VA. So again, those same contacts, I would say. And then the Area Agency on Aging is always a great place to go to get just some basic information.
And we do have just a little bit of time
Okay.
left, so maybe quickly, I'm kind of skipping down a little bit, but maybe we can go back to adult daycare
Sure.
and just let us know, are there any options for help getting payment for that?
Just similar. Medicaid will pay
Okay.
some in order to, through the home and community-based waiver program, to keep people in their homes in the, the most appropriate place. And so that's an option. A lot of it's private pay, and it ranges about $70 a day. So it's actually one of
Okay.
the more affordable options.
Yes, sounds good. Well, I really want to thank you for being with us today.
Yeah.
You've shared a lot of great information I'm sure our viewers will appreciate. So
Thank
you so
you for
much.
the opportunity.
Absolutely. Coming up next, this is a lot of information to take in, but how does it really apply to your personal situation? We'll get some help with that right after this. Stay with us.